Hello, everyone, and welcome to Now You Tell Me, Navigating Care Throughout the Lung Transplant Journey. My name is Abby Thaxton, and I work for the Foundation as a part of the Advanced Lung Disease and Lung Transplant team. I'll be moderating the session today and be introducing our other speakers in just a minute. But before I do, we'll just review a few housekeeping items. This session is being recorded and will be available after the event on the CF Foundation YouTube channel. You'll be notified via email when the recordings are available. After our presentation, we'll take a quick 5-minute break, and then we'll be hosting a 45-minute extended Q&A with today's speakers. So please hold all of your questions until the end, but jot them down so you don't forget those important thoughts popping up. If we won't be able to answer questions about individual diagnoses or treatment plans, we always encourage you to use the information you learned today and have productive conversations with your care team specifically. The extended Q&A will take place right here at 9:15. If you experience any technology problems during the session, please visit the help desk on the left-hand side of your screen. We also want to remind everyone of our community guidelines. Please be kind, open-minded, and respectful of everyone's opinions and life experiences. And please don't ask or give medical advice. If you need staff support at any time or want to report a violation, we encourage you to also visit the help desk. So now on to our real stars and experts this evening. I'm so pleased to be able to introduce you to our panel speakers for this lung transplant topic. And let me first pass it to Adrian.
Thanks, Abby. My name is Adrian Garza. I currently live in the Dallas area. I grew up in Odessa, Texas, and I was diagnosed with CF when I was 3 months old. I was fairly healthy up until I was about 20 years old when I began being hospitalized more often. I then moved to the Dallas area to see Dr. Randall Rosenblatt at Baylor Scott & White for him to oversee my hospitalizations more closely. I had my double lung transplant at Baylor Scott & White in 2014 when I was 32 years old. I am a physical therapist assistant, and I currently am the rehab manager at a skilled nursing facility. I would like to now pass it to Erica to introduce herself.
Thank you so much, Adrian. I'm Erica Tharrington. I'm the child of a person with cystic fibrosis who underwent transplant. I am also a CF research coordinator at the University of Virginia in Charlottesville. My mother had all of her care through the University of Virginia, but she was transplanted at the University of Pittsburgh Medical Center. In addition to all of this, I'm also a member of the Cystic Fibrosis Foundation Blue Ridge Board of Directors in Virginia. So I'd like to pass it now on to Dr. Ramsey Hachem.
Thanks, Adrian and Erica. My name is Ramsey Hachem. It's very good to be with you tonight. I'm excited about this ResearchCon. I think it'll be informative and a good dialogue. I'm a lung transplant clinician with special interest in cystic fibrosis. I work at Barnes-Jewish Hospital and Washington University in St. Louis, Missouri. Adrian and Erica, you've been on different sides of the lung transplant experience. Can you share what the lead up to the transplant looked like for each of you?
Yes, Ramsey, I'll get started. After moving to the Dallas area, I was in and out of the hospital every 2 months for the first year I lived here. I continued getting lung infections and needing to be on IV antibiotics for 2 to 3 weeks at a time. My doctor began at that point talking to me about having a lung transplant within 4 months of living here. Due to me, my lung function dipping down into the low 30s and upper 20s, I was on the transplant list for 4 years total. At one point, my lung function did become stable, and he was able to remove me from the list periodically. That lasted only about 4 months when my lung function began deteriorating again. The process of being put on the lung transplant list. It's pretty extensive, all the tests that you have to go through, including blood tests, scans, breathing tests, pulmonary pressure test. These tests are done to establish what number I would be on the lung transplant list, but also to rule out any other issues that could potentially make me not a candidate for a transplant. It was kind of overwhelming, but at this time I was put on the lung transplant list. Erica, can you tell me a little bit about your mother's experience on getting onto the transplant list?
Absolutely. Thanks so much for sharing, Adrian. So my mom's experience was quite the roller coaster. At the time when her physician, Dr. Dana Albon, and her began talking about transplant, she was relatively sick, and they were trying their best to keep her stable enough for a transplant. And so Dr. Albon put her on a year of cycled IV antibiotics like meropenem, so that she could even begin to go through that process. And after that year, she was listed, but only very briefly, at the University of Virginia. Her infection was at that point deemed uncontrolled. It was so severe in her right lung. So they felt like it was a direct contradiction to transplant, and they took her off the list. But Dr. Albon did not stop there. She insisted that she could be transplanted somewhere. And so she referred her to the University of Pittsburgh Medical Center, where she went under the whole process again. And so she became listed there. And so while all of this was happening, she was still receiving a lot of her care through the University of Virginia. And she had been hospitalized as the result of one of her infections. And during this stay, she developed a mucus plug, which caused her to desat, and she had to be intubated. At this point, it took her to the point where it became an emergency for her to get a transplant. Unfortunately, at this time, UPMC was actually temporarily closed for transplant due to some links, possibilities of a connection to mold and their transplant patients. So they life-flighted her to the University of Maryland, and they were hoping to maybe get her listed there. But fortunately, we didn't have to go through that process a third time, because in that short stay that we were there, they reopened UPMC's transplant center. And so she was able to get up there and was transferred to their ICU, where she remained until she underwent her transplant. So the whole process itself taught us that we had to be on our toes, that you had to be flexible and go with the flow on things for sure. Adrian, can you tell us a few of the things that you wish had been explained to you pre-transplant?
Yes. Thank you, Erica, so much for sharing. Yeah, I would say everything moves pretty fast when you're being listed. So a lot of the information that they're giving you is, it's just overwhelming. I do feel like I wish that an earlier stage, I would have been talked about or taught more about the transplant and what to expect. Some transplant programs do have mentor programs. So if you're a patient, you should definitely check into that. Ask your CF center or your transplant clinic if they have something like that. I did have the opportunity to speak to someone who was on the transplant list, which that did seem to kind of, put my mind at ease, kind of help me to maybe accept that this might be a possibility. I will be honest with you, I didn't think that I would ever have to have a transplant. I think I was sort of in denial, probably more or less because I did pretty well, most of my life. And up until, I started having more problems and needing to look at getting the transplant. So the other thing I would say is, just hearing a variety of experiences to give you a better picture of what to sort of expect when it comes to the transplant, for sure. Erica, as a caregiver for your mom, what would you have liked to see pre-transplant?
Well, it was really hard for me to think about what might have happened if we could have considered transplant for her a little bit earlier. Folks with that advanced CF lung disease, it's kind of a double-edged sword, because when we're looking at the way that these old lung allocation scores were handled, age, you had to be in this like very perfect spot of sick enough, but not too sick to get the transplant, because you want there to be a successful post-transplant experience. And I think that if maybe she had been considered a little bit sooner, and maybe at a little bit younger of an age, or before the lung disease got too bad, that she may have had a more successful transplant experience afterwards. Other part about it is that, we felt very tightly connected with the VA care team. And because we didn't really have the time to go and get to know the UPMC care team, there was not that same amount of trust, not that same amount of advocacy for ourselves to feel like we could ask all of the questions, because we were just so grateful that she was being listed somewhere else. And so I think that, really defining that difference between care centers and transplant centers, and really having that explained to us would have helped. So Ramsey, with that, can you tell us a little bit more about the differences between transplant centers and CF centers?
Sure. Erica and Adrian, thank you so much for sharing your personal experiences. Those are so important and so vital to this discussion that we're having tonight. As everyone, I think, recognizes, there's a big difference between CF care centers and transplant centers. Sometimes both are in the same institution, and that makes things a lot easier than if the CF care center is at a different institution than the transplant center. But even when they're in the same institution, they're separate. And that separation tends to generate a lot of anxiety and angst, and maybe not mistrust, but some difficulty in dealing with the transplant center, mainly because there's this incredible familiarity that people with CF and their families have with their CF care center that they've been seeing for many years, sometimes throughout their adult life or in childhood throughout their life. This slide is from the foundation website, and you can find a lung transplant center, as the title of the slide suggests, for both pediatrics and for adults. There are 77 adult lung transplant programs in the United States, and you can find the closest one to where you live, the closest one to the CF care center, and find others as well. Now, the CF Foundation has recognized that this intersection between CF care and lung transplant is a difficult one, and people are in a very vulnerable situation where they need a transplant. They have more severe health problems. At the same time, there's this big transition that's happening in their life. And so the CF Foundation has invested a lot of effort in bringing CF care centers and lung transplant centers together to work better together. This initiative started back in 2017 and has really developed into a much better process for the centers that have participated. It's really built on developing better relationships between CF care centers and lung transplant centers. so that there's a good way of communicating between the two centers. It's important to begin to talk about lung transplantation at an early stage rather than when it's absolutely necessary or when it's urgent or emergent that someone has a transplant. It takes a lot of preparations before a transplant, mentally, socially, sometimes financially. People often have to move either before a transplant or in the early period after the transplant to be close to the transplant center. So it's a big stressor on people's lives and their caregivers' lives. So it's often best handled early in the stage of someone's advanced lung disease rather than at a point when it's become urgent or emergent. So this initiative that the CF Foundation has put together has really made a difference in my view and has facilitated the care of people with CF and their families so that they're referred at an early stage and that referral process is more streamlined by building these good relationships between CF care centers and lung transplant centers. Now, as many may be aware, the lung allocation system recently changed in March of this year from what was called the Lung Allocation Score to what is now called the Composite Allocation Score. And the next slide on the PowerPoint presentation will show you what the Composite Allocation Score is based on. Obviously, the higher the score, the shorter the waiting time for transplant, and lungs are allocated based on this Composite Allocation Score now. This pie chart breaks down the components of the Composite Allocation Score, and the main drivers of that score are a candidate's medical urgency that receives 25% of the Composite Allocation Score. That's the orange slice of the pie, or a quarter of the pie. The next component is the likelihood of surviving 5 years after the transplant. That's in the blue slice right below the orange slice. This is one of the main differences between the Composite Allocation Score and the Lung Allocation Score. In the Lung Allocation Score, survival after transplant was limited to 1 year, and here it's up to 5 years. This is all predicted based on characteristics at the time of listing for transplant, but in the Composite Allocation Score, it's predicted survival out to 5 years after transplant. The third largest component is being listed at an age younger than 18, and that's the dark blue or navy slice that accounts for 20% of the score. Other factors are all at about 5% of the score, and they include variables like the blood type, the height, having had a previous or having been a previous lung donor, travel efficiency, and proximity efficiency. Those are metrics that are meant to make transplantation and offering a donor as efficient as possible during the transplant process. And the next slide here is a direct side-by-side comparison of the Composite Allocation Score, or CAS, compared to the Lung Allocation Score, or LAS. As I said earlier, one of the major differences is in the predicted post-transplant survival metrics. In the old Lung Allocation Score, that was only out to 1 year, whereas in the Composite Allocation Score, that's out to 5 years. And other variables that are included in the Composite Allocation Score, like someone's blood type, or if they have HLA antibodies, or their height, those were not included in the Lung Allocation Score. Similarly, a pediatric recipient, or a recipient who was a previous living organ donor, were not included in the Lung Allocation Score. And lastly, the two metrics about efficiency of travel and proximity of the donor to the recipient were also not included in the Lung Allocation Score. In the bottom half of the slide are a couple of other differences that are noted. The Lung Allocation Score ranged from 0 to 100, whereas the Composite Allocation Score ranges from 0 to 50. One really important difference between the two scores is in the lung allocation score, weightless survival was double weighted. In other words, there was a strong emphasis on weightless survival, whereas in the composite allocation score, weightless survival and post-transplant survival were equally weighted. So that's the main differences, or the side-by-side comparisons between the lung allocation score and the composite allocation score. Now, Adrian, would you be willing to share what it was like to get the lung transplant call?
Yes, thank you, Ramsey. So actually, I got the call for the first time. We were at home eating dinner, and I kind of didn't know what to expect. I started scrambling around and telling my wife we need to like pack a bag and go to the hospital. Went in. My family actually came down from Odessa, and we were there at the hospital for roughly about 12 hours, and they found out that one of the lungs had an infiltrate in it. So they said they couldn't do the transplant at that time. Now, the second time I got the call, it was at 12:30 at night. I thought my alarm was going off for me to wake up to get ready for work. So I silenced it. And then phone goes off again. It's my mom calling. And so I kind of got worried because, why is she calling me at 12:30 at night? So I answered, to check in or whatever. And she said, the transplant clinic's trying to call you. And I was like, oh. So they called me right then. I clicked over and they told me they had some lungs for me. So kind of the same thing. I don't think it was as crazy that time. We kind of knew what to expect. But I knew something was different when we got to the hospital because it seemed like everything was moving really fast. They were trying to hurry up and get, all the tests done they needed to get done, get me prepped for surgery. Whenever I got down to the OR waiting room, I think at that point I realized that I was probably going to I was going to have the transplant. And so I had my transplant at about 7:00 a.m. That day. The transplant lasted about 7 hours. So Erica, what was your mom's experience when she got the call?
Adrian, thanks for asking. It's one of those things where it feels like eternity, no matter how long or short it is, but as you wait for a pair of lungs. But from the time that my mom was transferred to UPMC, there was only about 2 months before she actually received her transplant. But this entire time she was in the ICU awaiting it. So that can be intense in itself. And much like your experience, she got a call once for lungs that ended up being unfit. So it was kind of one of those, everybody hurry up, wait. Oh no, that wasn't it. Thanks for the trial run. But then the next time it all worked out. And I think that one of the things that's really a core memory for me is that the transplant itself ended up taking 10 hours, and it was pretty rough on everyone. This very vivacious surgeon who was bubbly and so charismatic. At the end of it, when he came out to talk to us to let us know how everything went, he literally looked like he had been hit by a train. So I know that everybody's participation in it is so vital, and that, a 10-hour long surgery is very, very intense. So another thing to note is that while this whole experience was happening, my mom was intubated, and throughout her transplant journey, we had notebooks that we kept together, and it was kind of like a running journal. And the thing that I noted in there was actually that they didn't close her chest immediately due to the swelling of the lungs. but I was very excited that she had been weaned a little bit off the ventilator and that she was only at 35% oxygen at the time. But I knew that there was still a long road ahead of us. And she ended up being sedated post-transplant for 3 days before they woke her up. And she kind of, got to realize that she had just received a transplant and it was successful at that point. So, I think that all of that is to go to say that everybody's experience is different in the following couple weeks afterward. And, I think that, Adrian, like, what did you feel like after you woke up from your surgery?
Thanks, Erica. Yeah, definitely. Like you said, there's definitely a contrast there in the kind of the way things went. So when I first woke up, I wasn't really sure what to expect. I think I expected to be breathing much better, feeling much better for sure, like immediately. That wasn't really the case. I remember feeling really groggy. My throat was really hoarse, really couldn't talk because of the breathing tube. And I had all these IV lines, 4 chest tubes, just lines everywhere, IVs everywhere. It was kind of a lot. And then while in the hospital, I had some mild rejection soon after, which my doctor said was pretty common for most transplant patients to have. One thing was difficult though is the pain. Dealing with that early on was difficult. They had me on a morphine pain pump that I could push every 15 minutes for pain relief, and I was pushing it every 15 minutes, and sometimes sooner than that. What I found out later is, maybe the morphine just wasn't working for me, because they ended up changing me to Dilaudid, and immediately, like, my pain was better. So I was glad for that, for sure. Due to also the breathing tube, I think it damaged my swallowing function. So I wasn't able to eat like regular food for a while. So I lost about 22 pounds and was super weak. Physical therapy was difficult because of that. And I really wasn't sleeping a lot because I did also have some hallucinations due to the morphine as well and all the other medications. So definitely.
Yeah, I can totally relate to that side of things, and being an outsider perspective, because like as a caretaker, I know my mother very, very well. And so I could kind of be her voice in a lot of ways to say, hey, this isn't normal behavior for her. She also spent a really long time in the ICU, which I feel like is a little bit different than your experience, Adrian. She was, the few months before transplant, and then about 10 months after the transplant, she was in the ICU, which can cause a ton of, same as your experience, weight loss. The PT was really hard. She had some ICU psychosis. And that's where I really had to speak up, and say, like, she's seeing things. She thinks there's a man in her room. She thinks she made the curtains. There's all of this other stuff, and find ways that we could both cope with that, because it was pretty traumatic for me to experience seeing my mom like that too. So I think that that knowing all of this prior to it would have helped me prepare for it a little bit. But maybe, Ramsey, you can talk to us a little bit about what others, including caregivers, could expect immediately post-transplant.
Yeah, sure. Thanks for sharing your experiences, Adrian and Erica. What you've described is fairly common, and really the early period after transplant can be very difficult, very tough on the person who just had a transplant. Obviously, because they just went through this very major operation. They have a large incision. There's a lot of pain that's associated with it. Pain medicines can help relieve the pain, but they can have a lot of side effects, including altered thinking, hallucinations, very bizarre and vivid dreams, much like what you described, Adrian. It's also a very difficult time for caregivers, and I think sometimes that is forgotten or not recognized, because here you are supporting your family member who just went through this major operation after waiting for a donor lung to become available for what seems like forever. And you have this major operation, and your family member, your loved one, is really struggling, and they're not acting themselves. They're perhaps seeing things that aren't there, or having really strange dreams that are affecting them. And then, aside from the psychological and mental aspects of it, it can be very difficult physically, because it's a very taxing operation. It's not unusual for people to lose a lot of weight in the early period after transplant. So it's really critical to be in the best nutritional shape going into it. But often that's not possible. And so losing some weight really makes it difficult to recover from the operation and do physical therapy and pulmonary rehab and so on. So it's difficult for the person who's recovering from transplant, for sure. It's also very difficult for caregivers as they're trying to support their loved ones and encourage them to do as much as they can and so on. And yet they see them having lost a lot of weight, see them struggling, see them in pain, see them having side effects of pain medications and high dose steroids. So it's a very difficult time period, both for the person who's having the transplant or has had the transplant, and for their support people, their family members and loved ones. And PTSD, or post-traumatic stress disorder, is something that's probably under-recognized after transplant, and people may suffer from this for weeks or months, sometimes years, depending on the experience that they've had. So it can be very difficult and rough on everyone.
Yeah, definitely. I experienced some of that for sure. I mean, like you said, you're going through all this major surgery, and there's all these things coming at you, and all this new stuff going on, and then all the new medications that you really don't know how are going to affect your body, and so I think too, like having the mild rejection and them giving me like the heavy dose steroids right after that, I mean, that probably contributed as well. I do know that after I got off the morphine, it took about maybe a week or so for like the dreams and the hallucinations and hearing people talking and all kinds of stuff to go away. But yeah, it's a real thing, because you can't get that stuff out of your mind, and it's definitely something that you hold on to for sure.
The list of medications, Adrian, I can really resonate with that part of it, because I think that we've discussed this before, but you feel like going into transplant is going to be the solution to this problem that you've has kind of ruled your life for a very long time, and you're hoping that the solution also comes with sort of an easier path, but that's not really the case. And, the laundry list of medications continue. The amount that you have to pay attention to the detail of these medications, and know when to take them and what to take them with and how much to take, and really become an advocate for yourself. And if you're the caretaker, help your person be an advocate too, while simultaneously trying to advocate for them, like Ramsey said, in very difficult situations where you're kind of the bad guy because you want them to succeed and you want them to survive. And it's also really, really hard, especially after such dramatic weight loss. 22 pounds is a lot, Adrian. I think the same sort of thing. My mom had gained a ton of weight just to qualify for this transplant. And then I watched it whittle away post-transplant. And then, she, like many other people with CF, she didn't have a ton of muscle mass. And that then being forced to do all these physical therapies and learn to swallow again and learn to talk again. And I think that part is really hard. And so I appreciate Ramsey for identifying that the experience can be traumatic, not only for the person getting the transplant, but also for the people who are taking care of them. And I think that one of the things that I wish that I had known beforehand would have been how I was going to handle that and how I was going to be a better advocate for my mom and what I was going to do in those tough situations. So, Adrian, do you have anything else to add to that before we move on?
No, I mean, I think Ramsey pretty much hit the nail on the head. I mean, you as well. I mean, I think, unfortunately, everybody's going to have to go through, some of what we just spoke about. And, just like you said, it would be nice to kind of maybe just have a heads up that this is what you're going to have to go through, and it's going to be tough. And, mentally, you just have to be strong. If you're not mentally tough, physically for sure, but mentally is a part that I think people don't always think about, for sure.
Yeah, along those lines, Ramsey, how common are these side effects of lung transplantation?
Yeah, that's a good question, Erica. These are fairly common side effects in the early period after transplant, or fairly common experiences that both you and Adrian described. There are some people who cruise through. So I don't want to make it sound like it's awful for everyone. It certainly can be awful, as you've described, but some people just cruise through. Now, I think in preparation for a transplant, it's important to recognize that although we've been waiting for the opportunity to have the transplant, and this is sort of what we've wanted for the longest time, it may not sort of make you feel fantastic on day one. And you may feel terrible on days 1 through, hopefully not too many days, but for some period of time, you may feel terrible. And it may be very difficult. And it's not only difficult on the person who's just had the transplant, but as I said earlier, it's difficult on the support person and the rest of the family as they struggle through this. It's really important to recognize that this is possible ahead of time, because it really prepares you for, I don't want to say the worst case scenario, but it prepares you for what might happen, so that when it does happen, it is recognizable as something that could have happened. So it's probably a good idea for people to talk about that early period, the first few days, and what might be expected with their providers before transplant, so that everybody's sort of on the same page that, yeah, it may be very difficult, maybe painful, You may experience strange thoughts or have hallucinations, bizarre dreams, those kinds of things. Not necessarily, but those may happen. So it's important to recognize that that's not uncommon. Now, there's a lot of other side effects of medications that are necessary after transplant. And as we'll talk about in a few minutes, there are a lot of problems associated with transplant in the short term and in the long term. So there's been a lot of interest in research in lung transplantation that's really focused to improve outcomes, mitigate the side effects of medications, but really improve long-term outcomes after transplant. So the foundation has developed this initiative around lung transplant and put together this lung transplant consortium, this CF Lung Transplant Consortium, that's made up of 15 sites in the US and one in Toronto, Canada. Our site in St. Louis is one of the 15 sites, so we're very privileged to be members of this consortium. And these sites are all lung transplant sites that have a specific interest in people who have CF and are dedicated to the care of people who have CF before transplant and after transplant. And as a consortium, we're working together to do research in lung transplant, especially for people who have CF. And one of the work that we're doing is putting together this biorepository and registry. And the aim of this biorepository and registry is to study chronic lung allograft dysfunction, or CLAD, also known as chronic rejection, which is really the biggest long-term problem after lung transplantation. So we're trying to identify biomarkers and better understand the mechanisms for the development of chronic lung allograft dysfunction by collecting specimens after transplant. And the specimens include bronchoalveolar lavage fluid, or BAL fluid, as well as blood specimens from people who have CF as the indication for their lung transplant, as well as people who don't have CF as the reason for transplant. And these 15 sites are sending in specimens to this central biorepository with the ultimate goal that these specimens will be used to couple with the patient registry, where clinical information is updated so that we can better understand the development of chronic rejection, or CLAD. And as of a couple of weeks ago, over 600 individuals have been enrolled at the 15 sites. So this is a very large protocol and a very large registry. And nearly 1,000 samples of blood have been collected, and almost 500 samples of BAL have been collected. So this is really a fantastic opportunity that we've been involved with, that's sponsored and run by the foundation, that I hope will improve long-term outcomes for everyone after transplant, especially people who have CF. Now, Adrian and Erica, would you share your experiences after transplant?
Sure. Thanks, Ramsey. So yeah, after my transplant, going home, I think echoing kind of what Erica said about thinking, having CF, you're always going to take a lot of medications and breathing treatments and all that. When I went home, I continued to have to do some breathing treatments for a short period of time. The amount of medications I was taking had actually gone up. And then there's, like she said, specific times you got to take the medications, and with food or not food, or there's kind of a lot of different things going. The other thing, I think, like I had moderate lung rejection, which I was hospitalized for. They gave me a medication that helped the rejection, but also caused me to have multiple infections. So I was in and out of the hospital for a number of things. I had pneumonia once. I had a chest infection at one time where they had to do surgery to remove some cartilage in my chest. And then I had 2 back infections that I had to have IV antibiotics for both of those times. So yeah, in and out of the hospital quite a bit, the first 9 months after my transplant. So yeah, that part was rough to kind of get through. And I think early on I was expecting, that it was going to be so different, and it was very similar to what I was kind of going through prior to my transplant, for sure. So I guess the one thing that kind of hit home to me is when I, talked to my doctor about some of that, is he said, you're really trading one illness for another. You had CF, you had all these things going on that you had to deal with. And now that you have a transplant, there's still things that you have to sort of work through. And, the possibility of rejection is a big thing. You got to keep yourself from getting sick, things like that. Erica, you want to tell me a little bit about your mom's experience after transplant?
Yeah, so similar to yours, Adrian, but a little bit more extreme, was just the fact that I don't think that we were prepared for how quickly she got she got an infection post-transplant. She was only out of the hospital for a day before we were being readmitted through the ED for an infection. And, who knows? I think that we really beat ourselves up about how that could have happened. We didn't really go anywhere. It's not like we were like, yay, you're free, and went out to dinner and out on the town or anything like that. We had, Ramsey had mentioned this earlier, we were one of those families that had picked up everything that we owned and temporarily moved to Pittsburgh. So we were staying really close to UPMC itself. And I think that we were just shocked at wow, this went from you were feeling great and off oxygen, and the next day you're desatting again because you've got a harmless infection and being readmitted. So I think that side of things was pretty difficult for us, and that kind of started a cascade of other things that ultimately led to my mom's, pretty critical infections and eventual passing. So I think that for us, that sort of unexpected, back to you, we were really hopeful because it's true. Like Ramsey said, some people just fly through this thing and they're really strong and they come out stronger, and that's what I want for everyone. But there are those few times where folks have a really difficult time with it, and it's not the sort of storybook ending that you want post-transplant. But I know that knowing all of that, I would do it again a million times. And because every one of those days that I spent with my mom going through this whole process was worth it, to have her those many more days, because she was one of those people who this was her last option. So I think that you kind of have to come to that realization that it's a decision. It's a decision that you have to make for your life, and be super informed and ask all the questions and really be an advocate for yourself. And I think that if that's what anybody can take away from this, is be empowered to know everything. There are no silly questions. There's nothing that that you can ask that your team hasn't been asked before. And if they don't know the answer, like they'll find it out for you, and really have a game plan for that whole thing. And I think, you know, I see it all the time. I see folks go through this and come out on the other side on top. And those are the hopeful stories that I want everybody to kind of leave here with, despite all of these trials and that we've discussed today between me and Adrian. Like there's definitely a lot of hope. And I think, Adrian, you're absolutely the picture epitome of that.
Definitely.
Ramsey, so do you want to talk any more about mental health side of things, or anything post-transplant that we missed out on?
Yeah, I would just echo what both of you and Adrian said. I think it's important that we recognize the mental health aspects and the challenges that arise after transplant. And in many ways, preparation is critical to sort of recognizing that what's happening is not uncommon. It's not something that's necessarily unusual. Now, obviously, there are unusual problems that can come up, but many of the things that both of you all have described are not uncommon problems. I think that is often reassuring for people and their family members that this is not unusual. Now, in your opinion, what better preparations could be done before transplant, other than recognizing that these potential problems can arise?
I mean, I would say, you know, I know at one point we had talked about maybe just having like some type of, you know, learning experience, like pre-transplant, where, you know, you go through like a course sort of where you're, you know, learning about, you know, what to expect, maybe even like how your medication regimen might change, things like that might be important. Also, you know, just kind of the stuff that we said, what to expect, what could come, just so you're prepared, I guess, mentally, you know, for that.
Adrian, I think that you can probably speak to this one too. And I know that you've mentioned it before, but just like how critical it is to continue with your care. I know that, you know, firsthand that CF folks go to a lot of appointments, and it doesn't end post-transplant, like all of the other stuff that we were talking about, like the meds and the appointments don't stop there. And I think that it's important, and maybe Adrian and Ramsey, you guys can speak to why that's so important to continue to follow through and be an active participant in your care post-transplant.
Sure. Yeah. I would say that's at the top of your list. You know, make sure you do what your doctor says. Make sure you take your medications. You know, being very like diligent with that is very, very important. You know, the reason that I found out that I had rejection, you know, in the past is going to the doctor. I mean, you know, my doctor had told me multiple times, you're not always going to feel bad. You're not always going to know. So I'd go to the doctor. They check my lung function. It was low, and it was like, you know, getting lower over time. And so they did, you know, some tests to check that, and sure enough. So yeah, I mean, you want to catch anything that's going to come up early so that they can definitely try to take care of it and head it off at the pass for sure. And I'm sure, Ramsey, you can kind of even definitely echo all of that.
Yeah, absolutely, Adrian and Erica, you're spot on all of those ends. There are a lot of problems that can come up after transplant that range from side effects of medications to infections that are brought on because of immune suppression to complications of rejection. And you really need a lot of careful attention and unfortunately frequent office visits with your provider to check into all of those things. Many of the problems can start out without causing any symptoms and yet could be detected with pulmonary function testing or blood tests or imaging studies. So it's really critical for good outcomes that people have close follow-up after transplant. And people with CF are very unique lung transplant recipients because although they've had a transplant and maybe the lungs are doing very well and there are no pulmonary problems, but you still have CF and you have all of the other manifestations of CF, whether it's pancreatic insufficiency or diabetes or bone health problems or sinus problems or GI problems. So the CF Foundation put together this working group to develop consensus statements on the care of individuals who have CF who have a transplant. I was fortunate enough to be a member of that consensus writing group. And we had 32 consensus statements that are really meant to provide guidance for lung transplant clinicians who may be less familiar with the care of people with CF, because there's a lot of variability in experience of caring for people with CF after lung transplant. So I hope that those consensus statements are helpful. The main issues in very broad terms are to recognize that it's really critical to continue longitudinal care for CF-related problems that are not specific to the transplant, like diabetes, bone health problems, pancreatic insufficiency, GI problems, those kinds of medical conditions. Now, as both of you alluded to, this can become almost overwhelming, that if you're going to see the CF care team or specialists for sinus disease, for GI problems, diabetes, bone health, and your transplant team, it can be a big burden to see all of those specialists and make all of those appointments. One issue that is emerging is the concept of shared care. And there are different models of shared care of how does the transplant team and the CF team work together in caring for an individual who has CF. And there's no right model, there's no wrong model. I think the ideal model really depends on a number of factors, including geography of where does the transplant recipient live, how close are they to the CF team, how close are they to the transplant team. But ultimately, what's critical is recognizing that it's important to maintain longitudinal care and follow up for all of these health problems that can arise. In this shared care models, there was a white paper that was published just earlier today, earlier this year. And it described two broad models of sharing care. One is where the transplant team coordinates and provides care for the entire patient. In other words, takes care of all of the potential health problems that one has. That really requires expertise in CF to be built into the transplant team. The other model is more of a multidisciplinary approach where a lung transplant recipient sees the CF team and the transplant team, and there's very close collaboration and close communication between both teams, and maybe some specialists who have experience in CF, for example, ENT for sinus disease, or diabetes specialists with expertise in CF. So that's really important. And again, as I said, which model is best really depends on a variety of factors.
Thank you so much for sharing that, Ramsey. I think, unless Adrian, you have anything to add, we can move on a little bit and we can talk about NextBreath. Is that okay with everyone? Okay, so NextBreath is an online 2-day event for people with CF who are living with advanced lung disease or experiencing lung health complications, as well as their family members and caregivers, to find support and engage with peers who understand in an inclusive and compassionate setting.
This event will take place on June 13th, 14th. Day one of NextBreath will focus on pre-transplant journey, as well as living with advanced CF lung disease. And day two will focus on the experiences of lung transplant and life after transplant. You can register for the event today. The link to the registration is in the chat.